Thank you very
I
much.
need to give you this, too. There we go. There you go. And there you go.
Good, all right.
Just slip that on your shirt or tie. Should go right over your belt.
Easier said than done.
Yes, isn't it always?
Okay, I think so.
All right, very good.
Thank you very much for that kind introduction. You didn't need to read all of it, but I appreciate it very much. Yes, I've been a family practice doctor. I've practiced in the emergency room for over 20 years. And I was looking for some medical education in 2012, and I came across a stem cell medicine course. I was thinking that it was going to be oncologist and rheumatologist and hematologist. I didn't tell them what my background was. I studied like crazy before the conference, and I sat in the back and I didn't talk to anybody because I was anticipating that they were going to find out that I didn't have the credentials to be there. It shows you how ignorant I was about it. What I learned at that conference changed the direction of the rest of my career. And I've been studying stem cell medicine and functional medicine, which I'm going to try to bring together with you. These are paradigm shifts in medicine. I'm going to be describing to you new ideas about pathology, about it is that we get sick. Stem cells play a central role in that. So do so many things. As we've been talking about, medicine is so fractured right now. Getting records back and forth and everything so hard. And I see it every day in the emergency room. I mean, patients are lost. And unfortunately, one of the things that we're most lost about is focusing on the issues of why we're getting sick. And I want to bring that to light to you. I want to shine some light on that and hopefully stimulate some interest. It can be overwhelming. It's overwhelming to me. So what I guide you to is to just open your mind to that possibility and take some steps towards that, okay? My background, which he's so lovely described, I had a very general background. I was frankly most interested in neurology initially. And my first rotation was neurology, was treating sick brains. And one of my first patients in 1986, it's been a while now, had MS. And it was my opportunity to present the physical findings. I was the medical student. I was the lowest totem pole, right? And the resident went over the laboratories, and the chief resident went over the differential diagnosis, yada, 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 all the way up. And finally, at the end of the table, and this was an amphitheater filled with doctors, the guy that wrote the textbook for neurology that we were all studying, you know, the grandfather of this specialty, at least in San Antonio, he got up to talk. And he talked for about 30 minutes about MS. And at the conclusion, he says, well, he probably has multiple sclerosis. Let's bring him back next year and restudy him. And that was all we had to offer. Now, mind you, we didn't have MRIs or CTs back then or any of the immune modulating medications, but it was devastating to me. And neurology, frankly, for the most part, is a very depressing area of medicine to be because most of our patients continually to get sick. So I changed my direction. I really wasn't sure what I wanted to do. I decided to go into family medicine. I just wanted to be, you know, Marcus Welby. So that's what I did. And I did transition to the emergency room, and I've loved my career there. It's been a great deal of fun. But I found these two areas of medicine, and they are complementary. Functional medicine ask a very primitive question, but just merely asking the question carries you to different areas. Why did you get sick? That man that had MS, we never asked that question. Why do you have that neurologic disease? Merely asking that question are there things that happen to him to cause his brain to get sick? And the answer to that is yes, there are. And we're going to touch on a couple of topics there. Along the way, I found regenerative medicine as well, and that really is stem cell medicine. The fact is that we have cells throughout our body that are renewing, that are recognizing injury and repairing. And the fact is that we can take stem cells in a variety of forms, a wide variety of forms, including fetal tissue and umbilical cord blood and all of these things, and we can use them to stimulate our own body to restart and to re-heal. And we'll touch on that. We have an epidemic of autoimmune disease. This is increasing very markedly, so much so that medicines like Humira and Enbrel and other immune modulating medications will quickly outpace cholesterol medications as the most frequently prescribed medication. These medications blunt your immune system so that you don't have as many symptoms from the disease. But again, unfortunately, most medical doctors are focusing on symptom relief and not disease process. We haven't had a whole lot of hard studies proving what it is that I'm showing you today. We have individually had patients that responded with MS, with Alzheimer's, with Parkinson's disease. But we haven't had the studies to prove it. Finally, we are getting some of those studies. So let me ask you, why is it that we get autoimmune disease? Why is it that we get sick? Anybody have any ideas? Yes, sir.
Flying too many airplanes.
So, what you're saying there is that we are exposed to pollutions and toxins in the air? Absolutely, absolutely. And the mitochondria gets insulted. The mitochondria is responsible for getting those toxins out of it. Many of those toxins rest in the fat, and it's much more difficult to get it from fat. You have to slowly leach it from a long period of time. But you can support the mitochondria with certain natural things to help the mitochondria detoxify. What else?
How about Crest disease?
It is an autoimmune disease, and Crest disease, like so many of these things, is really a description of symptoms. And right now, do you know the acronym for it? What does Crest disease stand for?
Well, it's the building of calcium. I don't know what it stands for, but it's the building of calcium in your joints and around your heart.
Correct.
The body
And
produces too much calcium.
And when people start developing autoimmune disease, they become susceptible to developing other autoimmune disease. So you get Hashimoto's disease, you're more likely to get lupus, you're more likely to get MS, you're more likely to get Crest disease, and it goes on and on. The immune system gets worse and worse. The fact is that my logo, which is a tree, really describes the underlying design of this disease description. The leaves of the tree are the symptoms, but they are not the cause. The cause is all of the things at the root of the problem. So most of these, if you look at it, you'll see it's an interaction between your genes and your environment. It's some kind of environmental exposure triggers the autoimmune disease, and it gets hyperstimulated, and finally you get sick. Your immune system starts reacting and attacking your own body. But the fact is that we can address these things if we know about them. Our biggest exposure to the environment is what? We talked about pollution. That isn't the biggest one. Who knows what the biggest one is? Yes, sir. Genetically modified foods. Yes. And in a larger sense, nutrition that we come in contact with. The foods that we eat get distributed on a molecular level and get rubbed against our intestine. It is our biggest exposure to the environment that we will ever have. The size of the intestine, the surface area of the intestine, is the size of a tennis court. And what we eat gets smudged against that surface every day of our life. So if we are not eating the right things, we will get sick. And there are things that inflame the intestine, that cause it to be leaky. It allows even other things to get inside the body. And guess what? Our immune system has to hyper-regulate in order to get rid of that stuff. So one of the central pillars is nutrition. Not only to be nutritionally complete, but also to make sure that we aren't continually being insulted. So all of the things about diet are important. Artificial sugars are crap. Don't eat it. It's poison. Don't do it. I've got a doctor that comes in, he's got Snapple, artificial sweetened Snapple. He brings gallons of it. And I say, doctor, you just don't know what you are doing to yourself. You just don't know. So this, in essence, is a little bit about functional medicine, and that's why I laid it there. You can read it in detail, and I've kind of examined some of these here. So I mentioned that we really didn't have a whole lot of data proving functional medicine. That's now changed. There are 2 doctors that have done wide studies on big problems and found response. This is amazing. Dale Bradison is a researcher from UCLA. He has treated Alzheimer's disease. And guess what? He's reversed the course of most of his Alzheimer's disease using nutritional and functional medicine principles. He has produced 2 studies, and I guide you to look his name up and buy this book and incorporate some of the things in there. The second doctor, Terry Walls, is from the University of Iowa. She herself has MS. She was in a wheelchair. She could not any longer practice medicine. She started going to a functional medicine doctor. She started slowly getting better. She progressed then to a walker and then to a bike, and now she bikes on a regular basis. She won, and now she treats MS, and she's created a whole foundation for MS. And she won Doctor of the Year award last year. She took the stage and walked up on stage. Truly amazing. So, surprisingly, stem cells play a central role in this as well, in autoimmune disease. Now, we're going to talk about joints, and I'm going to tell you that stem cells are a great treatment for arthritis. But the fact is that they have effect on the immune system and can be used in parts to help with autoimmune disease. How is that? Let me show you. So stem cells, as an introduction, are early cells. They are neutral cells waiting for illness and injury to occur. And when that happens, they spring forward and they help you heal. They do have the ability to turn into a wide variety of tissues. They are everywhere in your body. They're in blood, they're in liver, they're in brain, they're even in teeth. They're everywhere. One of the richest sources is actually your adipose tissue, and he was describing that I have done lots of treatments using adipose tissue, separating out the stem cells and injecting them and using them therapeutically.
Explain that.
I will. So as I mentioned, we can get them from a variety of areas. Historically, we've been getting them from bone marrow. We've been doing bone marrow rescue since the 70s. We would give, say, a patient with leukemia, chemotherapy agents and wipe out their immune system, their entire immune system, and their blood-making ability. And we would give them a donor bone marrow sample Now, I want you to think about how simple this is. We take a needle and we drill down to the bone marrow, and that's not so pleasant, and we merely take a syringe and we pull back the bone marrow. We put that in an IV, and we drop it into a patient that we've given chemotherapy agents and wiped out their immune system. And those stem cells will find their way to the bone marrow and regrow the entire immune system. Blood, white cells, red cells, everything. Amazing. We've been doing that since the 70s. We can also get them from blood. Blood has a very low percentage of stem cells, but they are there, and there are some ways of using this. Now, I mentioned that these stem cells are early neutral cells, right? It happens that they're so early that I can take my stem cells and treat you. I could take your stem cells and treat me. They are that early that they don't demonstrate the major histocompatibility complex on the surface of their cells, and so they don't trigger the immune system. And it appears that even a greater role for them is not actually to turn into the cells that are needed to repair, but to coordinate with your immune system to set the stage for repair and to stimulate your stem cells to come forward. So we are finding now that we have other sources for stem cells. I know this is a little complicated. We have amniotic fluid that is loaded with stem cells. We have umbilical cord cells, Wharton's jelly, which is the jelly around inside the placenta. We have placental tissues. And not only that, now we're finding ways of stimulating stem cells and finding the growth factors that are secreted from them, and they are called exosomes, and we can concentrate them into higher percentages, and this may be even a better form of treatment than whole stem cells. This field is rapidly developing, and my practice has changed even since I talked to you last. So we have generated a history of treating arthritis with stem cells. They are remarkable at it. We'll take stem cells from a variety of sources. I can take your own stem cells from bone marrow or adipose tissue and inject it into your knee. I can take stem cells from amniotic fluid or umbilical cord blood, separate out the stem cells and inject it into your knee, and they are effective in regrowing your cartilage and actually increasing the depth of the cartilage and reversing the process of arthritis. Now, the question is, why does it do that? The answer to that really has to do, if you go inside an arthritic joint, how many have had arthritic flares of their knee? Lots of us, okay? And when it flares, you feel it, it's warm. It's hot. It's almost like it's infected, right? So if we go in there chemically and look at what's going on, we find it a very toxic environment entirely. We have peroxidases and collagenases and all of these proteolytic enzymes. We're talking about enzymes that break apart proteins to be very high. It's anoxic. It doesn't have oxygen. It's a horrible, toxic place. So it's very angry for trying to repair the damage. What is literally happening is not that the cartilage is wearing away. What is literally happening is that the immune system is turned on, hyperstimulated, right? And is literally melting the cartilage. So before we begin to regrow the cartilage, these stem cells are interacting with the immune system, turning it off, or actually rebalancing the immune system to allow then the stem cells to come forward and regrow your cartilage. Hence the reason why it may be effective for many other conditions, like those autoimmune conditions. And this is what I teach and talk about to doctors across the country.
Is this true for slip disc too?
Yes. There are case studies of injecting disc and actually regrowing the disc. I will tell you that it is a high-risk procedure. Anytime you put a needle all the way into the disc, it's a touchy deal. But it is the only treatment known to actually regrow the disc and reverse, some of that flattening that you get. We've seen cases of the disc starting to plump back up. So I mentioned it's great for muscles. It's great for cartilage. It helps to heal tears. It heals tears in cartilage as well. And it also helps with neural conditions. So hence, it's helpful with neurologic conditions. And I have had some responses in neurologic patients. Let me drill down. I will tell you that we have the biggest success with knees. And this is a collection of some of the studies. So this is moving out of the experimental. This is stuff that we actually know about knees. I pulled 13 studies showing very consistent results using stem cells. And they were all kinds of stem cells, bone marrow, adipose tissue, a variety of things. All of them showed improvement within 3 months. All of them showed further improvement in 6. It seemed to level off at 12, and at least it sustained itself for 24 months. This is one of those studies. This is one of my colleagues from Florida, Eric Grana, and he compared bone marrow, adipose tissue, and just whole fat. He didn't bother separating the stem cells. He just injecting that. He could not tell the difference between all 3 treatments. These patients were arthritis patients that were considering having knee replacement. Their pain scale, just when they go in and ask, how bad is your knee? 0 to 10. You've heard doctors ask you that, right? Their average level was 6.3. At the end of the year of study, their pain level was down to a 3. They did a functional test. This is describing how active they are. 100% functional is having no problems with your knee at all. Being able to go play golf, play with the kids, whatever, go jog, not have any difficulty. That's 100%. These patients started at 52%. At the end of the year, they were 75%. They had 120 some odd participants. 10 of them ended up having a knee replacement. That does mean over 90% did not need knee replacement and had significant improvement. So, as I mentioned, these stem cells do help to stimulate the body to recover. This is a scientific slide that I use, that these are some of the hormones and growth factors that are spewing forth from these stem cells. We're learning more about this all the time. So the real role of the immune system, the reason why stem cells have an effect in autoimmune disease has to do with the body recognizing self or not self. The idea is that it recognizes viruses and bacteria and goes out and kills them, right? And not to recognize our self proteins. As we insult our body, that immune system gets hyper-regulated and it slowly starts to make errors. It happens that stem cells help to re-regulate that. This is one of my scientific slides. This is the antigen presenting cell. That means that it is presenting a protein to the T cell to say, do you recognize this or not? And if it recognizes it, then it starts spewing forth antibodies and cytotoxic cells to go and kill that protein. In autoimmune disease, I don't have it quite centered, but in autoimmune disease, it tends to hyperstimulate this Th1 pathway. And I know stem cells help to suppress that. This is the trunk of the tree. As I said, we have all those roots of the tree. It's coming up and it's flourishing out into the symptoms. The stem cells are right at the root of the tree. That's right it. That's right there. These stem cells, have effect on B cells. They have an effect on natural killer cells. They have an effect on cytotoxic T cells. They help to produce more regulatory cells, Treg cells. They reduce the activity of macrophages, all of this helping to re-regulate. Now, I want to be very clear about this. Autoimmune medications impair your immune system so that you can't fight off viruses and those other things. We have not seen problems with stem cells. It regulates it, but it doesn't impair your immune system so that you can't fight off those things. We have not seen that. And believe me, that is one of the things that I research most strongly. So I have left you some cards and whatnot. I want to open it up to questions. Obviously, I'm talking about lots more things than just arthritis. Yes, sir.
My wife has a rare autoimmune disease in the eye, ocular cicatricial pemphigoid.
Wow.
And I noticed you have skin disease.
Yes.
Has anybody done anything on pemphigoid pemphigus?
Wow. I have not done any research on that. However, there is one person in the country that I would guide you to. Do you have a pencil and paper? His name is Jeffrey Weiss, W-E-I-S-S. He is in the foremost of this field. He's on our board of directors. He treats macular degeneration. That was brought up today. He's treated retinitis pigmentosa and other vision impairing things. And just on the surface of what I knew about autoimmune disease and stem cells, I would say that that condition may in fact be something that responds. However, you do a literature search and you probably will find nothing on that disease. We've had a patient, now this is not the same patient, certainly not the same disease, and I don't want to portend that it is. But we had a patient that had psoriasis. This was a colleague of mine in American Stem Cell Centers of Excellence who had psoriasis all over his body. It's just a scaly skin disease, but to those that have it, it's unsightly, it's itchy, you know, it's just not comfortable. It really doesn't seem to cause systemic disease, but this man didn't respond to anything. Cortisone creams, immune modulating medications, all of that. He had an adipose stem cell treatment, had liposuction, and we separated out the stem cells. We re-injected the stem cells. His psoriasis went away, and he sustained treatment for a whole year. That's as far out as we have. We're still monitoring him.
So it's lasted a year.
Yes.
So do y'all think it's temporary?
You know, I do think so. I do think that he probably will need re-injection at some point. In the past, we haven't had ways of monitoring. We have not had ways of identifying dose or identifying when we need to repeat the dose. By following cytokines, there was a very interesting study out of Egypt where they treated chronic kidney disease. These are patients that were likely to need dialysis. And they gave them stem cell treatments. They injected it right into the kidney artery, and these patients improved renal function by 33%. And they sustained that for a year, and not only that, but they followed cytokines, and they could see the response of the cytokines that followed along this pathway that I was talking about, and they could see the effect, and they could see it starting to wane. So now finally we're getting some response, some idea of what to follow to tell us when we need to repeat, other than just, how are you feeling? And I hate to say it, that's most of what we've done in the past. How are you doing? How's your arthritis? Yada, yada, yada. Yeah. We need more and better tools. Yes, sir?
What's the downside of stem cell therapy?
It may not work, and it's expensive. Typical treatment for arthritis is about $5,000. If I'm treating a systemic disease, especially if I'm using functional medicine too, it's upward to $10,000 or sometimes more.
Is the insurance covering it?
Good question. The answer to that, the quick answer is no. I have heard through the grapevine that some people are starting to get knees approved. Now, I'll tell you what else has happened, though. 3 times in the last year, we've been approached by third-party administrators. I'm sorry, this is an area of medicine I don't know very well, but third-party administrators actually pay everything, and they are starting to approach us to say, let's use stem cells as an alternative to knee replacement. It's obviously less expensive. Knee replacements cost about $100,000 or more. So if I can get 90% response, which most of the data suggest, that's certainly a lot cheaper on the insurance company than having a knee replacement. So it may be an end run. It may be forward-thinking companies like Tesla and Google and Amazon or whatever that decide to include stem cells as an alternative. You know, our medical system is broken, and I'll tell you, I was asked at a political meeting what we need to do to fix it, and I don't know the answer. I really don't. Yes, sir.
Can you work with congestive heart failure?
There have been some reports on congestive heart failure, and the University of Miami has done some cases. Frustrating. It is frustrating. I won't tell you that the response has been great. I will tell you that there has been some progress, though. Yes, sir.
One more, a word that I haven't heard you mention is cancer. How we get it? Stem cells, I know they've been using for quite a while. They use it on our brother.
Yes.
Is it being more popular, use it more often?
So, this idea of inflammation that I've been talking about does have contributions to cancer. And there probably are some roles. What I'm doing, and the environment in the United States right now is there's a lot of eyes on what it is that I'm doing. Most of the cases, most of the problems that y'all bring to me, I will tell you that stem cells have a hope for you, and I'll present the data, but I'll also tell you that it's highly experimental and that the proof is not out there. Outside of joints for knees and elbows and ankles and everything, the proof of showing you a study that has treated 100 patients, just not out there. So because of that, most of our practices within the United States is very conservative, and I don't touch cancer. I just can't. And I think you'd understand why. I think there are some roles for stem cells, and that has to be kind of brought out, and it's probably going to be international studies. They're much far ahead of us in stem cell research. Yes?
I read recently where Jack Nicklaus, the golfer, has been going to Germany for many years to get stem cell therapy on his lower back. You wouldn't know that he's had back problems since he was in his 20s.
Yes.
And, but he's had to go to Germany to do it, and it's very expensive, $10,000, $20,000. So is that because they're way ahead of us, or he could do it here now if he wanted to?
Yeah, he certainly could get some treatments here. I would say that most of the stem cell doctors are really focusing on arthritis, and very few of them are focusing on systemic disease. I'm one of the few specialists in the country that does that. So if you find the right doctor and he's willing to treat and you're motivated to do it, you probably can find it. There are lots of clinics international that are doing that, and believe you me, one of the things that, you know, what are you learning? Tell us, teach us. One of our activities as a national board of stem cell physicians, and I am on one of those boards, is to continue dialogue with the FDA and create safety and to do this practice right, and that's a tall order. I was doing adipose tissue. I was doing liposuction and separating the stem cells. But the FDA came down with a position paper that suggested that that is more than minimal manipulation of tissue, and therefore it makes it a drug. Now, please don't overreact about that. They have reasonable reasons to be concerned, but the practice of what it is of separating stem cell from that is safe, and it should not be a drug. So there's misunderstanding on all sides. We all need to learn from that, and we all need to proceed safely. So we have a lot to learn, and that's why we've opened the door to discussions with the FDA. I'm sorry, I don't mean to speak all day. How are you doing?
What about diabetes, type 2 diabetes?
So diabetes is certainly an autoimmune disease, and we have seen response to stem cells. Can't say that we take somebody off of insulin. I can tell you that we, with stem cell treatments, and especially if a patient is motivated and is doing nutritional things in functional medicine, we can really make a big dent. Really make a big dent, yes.
Is that true for type 2 as well?
Yes, sir. Yes. I will stick around for a short bit afterwards. I really appreciate the opportunity. Is there a question? Yeah, one last one.
Would you repeat the doctor's name that does that?
Jeffrey Weiss, W-E-I-S-S, and he's in Florida. He's a very important researcher, absolutely, and a very nice man too. All right, well, thank you very much.